Today, I'm going to talk about hantaviruses. And there are many different types of hantaviruses. I'm going to really focus on the one that we associate with lung disease, which occurs in the United States and other parts of the world. So, what are hantaviruses? So, these are viruses that have their reservoir in mice. And people get infected not from other people, but from becoming exposed to aerosolized rodent urine, maybe rodent feces. So, typically, that's somebody who might be cleaning out a barn or a shed, and there's lots of dust flying with the broom, and they inhale that material. So, what hantavirus does is it starts out with flu like symptoms, like many infectious diseases, fevers, chills, that type of thing. But this virus, what it's known for is making your blood vessels leaky, especially the blood vessels in your lungs. So, a person will become short of breath, and when they present to a hospital and someone does a chest x ray, they have what's called pulmonary edema. Their lungs are whited out because there's so much fluid that is leaked into the air sacs of the lung, impairing the ability for oxygen to get into your blood. And this is something we see sometimes in individuals who have heart failure, for example, who are older, have coronary artery disease. So a young person with pulmonary edema may be hantavirus if they have no cardiac reason. So it's a non-cardiogenic type of pulmonary edema. And this can be very fatal. And oftentimes these cases might be missed because they present in the early days like a flu and then progress. And there was a very explosive outbreak in the mid 1990s occurring in the Four Corners area of the United States, which is the four corners of those states: New Mexico, Colorado, and Arizona, and I forget the fourth. But in that area, this seems to be a hyper endemic type of illness, meaning that it's something that's common. And sometimes it has to do with the mouse population. So if there's an El Nino year, there's more nuts and chestnuts and all the things that mice eat, that increases their population. People have more exposure to them. There's no vaccine for hantaviruses. There's no antiviral for hantaviruses. So if you get it, it's supportive care. The key thing is identifying it early and making sure those people are supported. And prevention is to be very careful when you're clearing out areas that have rodent droppings. And while we concentrate on the southwest of the United States, there have been cases in Pennsylvania, for example, and there are different hantavirus strains in different parts of the United States and different parts of the world. So it's not just something restricted to the southwest of the United States. So just be very careful when you're cleaning out barns, sheds, anywhere you think mice might have been in. Maybe that's an area, a time when you want to wear a mask when you're doing that so you don't inhale those particles.